Streaming worldwide, this is the Gospel America Television Network. It's time for Real Talk with the Jenkins, featuring Lady MJ, Pastor Marcella Jenkins, and Dr. G, Dr. Gary Jenkins. And now, let's join Real Talk with the Jenkins. Hi, everybody. Welcome to Real Talk with the Jenkins. I'm Dr. G.
I'm Lady MJ. And we are the Jenkins.
Now, Lady MJ, we've got a special guest that we're going to be sharing with you in a moment. He is a nationally renowned cardiologist, and he's based right here in San Angelo. And I'm excited to have him as our guest, none other than Dr. Milton Leon. And he has a practice called Cardiology Associates of West Texas. Now, how do I know that? Because I'm one of his patients. So we want to welcome Dr. Leon in a moment. We'll be back on Real Talk with the Jenkins. Real Talk with the Jenkins. We'll be right back after these messages. The definition of an expert is a person who has comprehensive knowledge, skill, and experience in a particular field. Angelo was an expert in sculpting and painting. But if you're looking for an expert in transmissions, then look no further than Gray's Transmissions. So if you find yourself in need of a new transmission, you need to make sure you have someone with expertise and experience.
We should know the word experts.
Are you suffering from P.A.D, peripheral artery disease? It's the blockage of arteries and veins, and if left untreated, you could suffer amputation. But there's good news here at the San Angelo Cardiovascular Center of Excellence, where you can schedule an appointment without a long wait in a comfortable and safe environment.
At one time I had pain in my legs. It was excruciating pain. And before I came over to see Dr. Leon, he worked on my legs and my P.A.D. I had P.A.D. problems. And now I'm very, very happy with him. I feel relief and pain-free. And now he has taken care of me, and he worked on my veins as well. And he cured that too, and I'm very happy with that.
So after being pregnant 4 times, the older I got, I started having numbness in my legs. I couldn't sleep at night. My legs felt really, really heavy. And my quality of life just kind of diminished. So I found Dr. Leon. I visited with him. He did a couple of evaluations on me and realized I would be a perfect candidate for P.A.D. treatment.
Call the San Angelo Cardiovascular Center of Excellence at 325-999-1212. And now, back to Real Talk with the Jenkins. Hi, everybody. As I said before, I'm excited because our special guest is none other than, who is this guy?
Dr. Milton Leon.
Dr. Milton Leon. I want to welcome you to Real Talk with the Jenkins.
Thank you very much, Mr.
Dr.
Jenkins.
Leon, you are awesome. We've been trying to get you for 2 years.
Yes.
That's how busy he is.
Yes.
Very busy man, so we're honored that he took the time to be with us right here on Real Talk with the Jenkins. Now, we've got some really, really important information we want to share with you, because a lot of people don't know about something called P.A.D, peripheral arterial disease.
You did well on that. Wow.
The brain is working every once in a while. Talk to us, Dr. Leon. You as a cardiologist, you deal with this all the time, but a lot of people don't know what that is, and they don't recognize the symptoms, because I really think we just haven't been educated.
That is correct. First of all, I want to thank you for the opportunity to be part of the American channel, the Gospel America channel, and it's an honor for me to be here and be in this interview with both of you. Peripheral artery disease is a disease that causes narrowings or blockages of the arteries that provide blood flow to the organs away from the heart, and particularly blockages to the arteries that provide blood flow to the legs. The main cause of this disease are the following risk factors: high blood pressure, diabetes, high cholesterol, and smoking. Also, lack of exercise may lead to development of peripheral artery disease.
So smoking also can lead to this.
That is correct. Smoking has been implicated in the development of coronary artery disease, but also causes narrowings in all the arteries of the body. And if patients develop blockages to the arteries to provide blood flow to the brain, they may have a stroke. But they can also develop arteries. Blockage to the arteries provide blood flow to the kidneys and increase the risk of hypertension. And if they develop plaques in the arteries that go to the legs, this is called peripheral artery disease that cause significant symptoms that may lead to amputation.
Now, correct me if 'cause I remember having this pain in my left leg, and I thought it was just, I don't know, I just thought it was just maybe
Arthritis.
yeah, I thought it was arthritis. I thought it was just something that was age related, and that wasn't the case at all. And I have to give props to you, Dr. Leon, because Dr. Chang suggested that I come to you. If y'all know Dr. Peter Chang, he great medical doctor, but he doesn't specialize in cardiology. You do, so he recommended you to me, and you did an examination and found out I had PAD or P.A.D.
That is correct. Several patients with P.A.D. may not have symptoms, or they may have symptoms that they don't attribute to this disease. They believe that their symptoms are due to natural aging process or due to some other condition that can cause pain to the legs, such as arthritis or lower back and pain and spine issues. The most common symptoms that the patients need to be aware that are due to peripheral artery disease are the following: pain of the legs with exercise that limits their ability to walk further and walk as much as they could a few years or a few months ago. Some patients also experience pain at night and restless legs, and they cannot explain where this is coming from. This could be a sign of peripheral artery disease. This is called nocturnal restless leg pain syndrome. Other patients experience discoloration of their legs and their feet, changes in the color, more red or sometimes more bluish color, and this could be a sign of poor circulation. It could be a sign of P.A.D. Other symptoms are some non-specific leg heaviness, fatigue, and sometimes mild swelling of the lower extremities. Also, decreased hair growth at the toes is a sign of poor circulation due to the presence of peripheral artery disease. So all these symptoms indicate that the patient may have peripheral artery disease, which is a very important condition to diagnose early and treat it, because if it is left untreated, can lead to amputation.
So
Wow.
I could have ignored this, not being educated to what was going on, and could have lost a leg. That's pretty serious.
That is correct. And it is very unfortunate that more than 50% of the patients that have undergone amputations in the United States for the last decade, despite the advancements in technology and public awareness, never had an evaluation for peripheral artery disease. So what I'm trying to explain, Gary, is that more than 50% of the amputations of the lower extremities could have been prevented if the physician had thought to do an evaluation to check for peripheral artery disease and treat these patients accordingly before they come to the last stage of gangrene of their feet or the legs that required amputation.
Wow. So it's really important for us to understand and watch our body, because our body talks to us and tells us that there's something wrong. But if you're not educated, then you're not looking for the signs.
That is true, Marcella. The public awareness about the symptoms of this condition is very important in order to start immediate detection and prevention. Peripheral artery disease can be detected very easily with a non-invasive test that we perform in our office, which is called ankle bronchial index test. What that test is very simple. We check the blood pressure in both arms and the blood pressure at both feet at the ankle level. And the blood pressure at the ankles should be a little higher than the blood pressure in the arms. If it is lower, significantly lower, that means this patient may have peripheral artery disease. That is the first screening test. If the screening test is abnormal, then we have more advanced testing to diagnose this disease, which is again a very simple non-invasive test, which is an ultrasound of the legs to check the arterial blood flow. That gives us a little more information about the extent of the disease and the location of the plaques in the legs. That will help me, the vascular disease specialist, to plan the treatment of this particular patient. What is also important is for the patients to be aware which are the conditions that raise the risk of peripheral artery disease.
Yeah, let's talk about that, because you had mentioned earlier that African Americans suffer from this in a much greater capacity than other races and than other nationalities. Why is that?
I believe that this is attributed to the higher incidence of diabetes and hypertension among the African Americans compared to the other population, and also Hispanic population have higher incidence of diabetes and hypertension, and that also puts them at much higher risk for P.A.D. than the non-Hispanic population.
So you were saying the high risk of being a diabetic. Okay, so why do we find in Hispanics and African Americans that they're more with diabetic issues and hypertension?
Yeah, most likely has to do with their diet and lack of physical exercise, and these are two major risk factors that increase the risk of diabetes and obesity, which is also another risk factor to develop heart and vascular disease.
Wow.
Well, again, most people don't know about it. Now, you mentioned something that was kind of important too, and I want to touch on it, and that is, Lady MJ, did you know that the economy has a lot to do, our social economic status has a lot to do with whether or not we get the kind of treatment that we really need.
Oh, yes.
You want to elaborate on that for a moment, Doc?
Well, to my opinion, everybody deserves to have access to health care, which could be affordable, and the basic health care and awareness of the disease is very important. So patients need to have access to a primary care physician who can help them understand their risk of developing heart and vascular disease, and of course other diseases, and emphasize the need for a healthier lifestyle and increase activity and exercise so we can minimize the risk of developing heart and vascular disease. As we also know, there is some genetic predisposition in development of cardiovascular disease, but this is nothing we can change. Patients with first-degree relatives with early development of heart and vascular disease have also high risk of developing cardiovascular disease. But there is nothing we can do about that. But we can change the risk factors that we can control. We can live healthier, eat better, do more exercise, so that will decrease the risk of us developing hypertension, risk developing high cholesterol, and diabetes. And these are the three main risk factors to cause heart and vascular disease. Also, I need to mention smoking is a lead factor for development of heart and vascular disease. And this is something, of course, we can control, and it is our choice.
I mean, go ahead.
Yeah, exercise. So how often should we be walking during the week?
Several studies in cardiovascular medicine have shown that walking briskly for at least 3 times a week and about 30 minutes each day, every time we exercise, it will significantly decrease the risk of heart vascular disease and also the risk of death from cardiovascular disease.
Wow. We're going to learn more about peripheral arterial disease in a moment. We're going to go to a commercial break. You're watching Real Talk with the Jenkins. I'm Dr. G.
I'm Lady MJ.
And
we are the Jenkins.
Real Talk with the Jenkins. We'll be right back after these messages. The definition of an expert is a person who has comprehensive knowledge, skill, and experience in a particular field. Angelo was an expert in sculpting and painting. But if you're looking for an expert in transmissions, then look no further than Gray's Transmissions. So if you find yourself in need of a new transmission, you need to make sure you have someone with expertise and experience.
We should know because we're the experts.
Are you suffering from P.A.D, P.A.D, peripheral artery disease? It's the blockage of arteries and veins, and if left untreated, you could suffer amputation. But there's good news here at the San Angelo Cardiovascular Center of Excellence, where you can schedule an appointment without a long wait in a comfortable and safe environment.
At one time I had pain in my legs. It was excruciating pain. And before I came over to see Dr. Leon, he worked on my legs and my P.A.D. I had P.A.D. problems. And now I'm very, very happy with him. I feel relief and pain-free. And now he has taken care of me, and he worked on my veins as well. And he cured that too, and I'm very happy with that.
So after being pregnant 4 times, the older I got, I started having numbness in my legs. I couldn't sleep at night. My legs felt really, really heavy. And my quality of life just kind of diminished. So I found Dr. Leon. I visited with him. He did a couple of evaluations on me and realized I would be a perfect candidate for P.A.D. treatment.
Call the San Angelo Cardiovascular Center of Excellence at 325-999-1212. And now, back to Real Talk with the Jenkins.
We are here with Dr. Milton Leon talking about P.A.D.
And P.A.D stands for peripheral arterial disease, and it's a disease that a lot of African Americans contract, and we don't even know that we do it. And I personally believe that we're not educated about this disease, and it's directly related to your heart. And if left untreated, based on what Dr. Leon has told us, you could lose a leg, or or suffer some other serious ailment.
Yes.
Okay. Well, we're going to go back to Dr. Leon, because I'm telling you, he's phenomenal. And Dr. Leon, we're just happy that you're with us and taking this time to be with us. But as I said before, there are so many of us in America, African Americans, that just don't have access to the type of medical treatment that is needed to properly diagnose and give a prognosis of PAD. Why?
Yeah, it is true that the incidence of peripheral artery disease, which is the condition that causes blockages to the arteries that provide blood flow to the legs, and if left untreated can lead to amputation, as you mentioned earlier, is much higher. The incidence of PAD is much higher in African American population than the other populations. Also, the Hispanic population has higher risk of PAD. To my opinion, and what the literature and the epidemiologic studies have shown, is due to the higher incidence of diabetes and high blood pressure in the African American population. And as we discussed earlier, this has to do with lack of exercise and diet, which increase the risk of diabetes and also increase the risk of developing high cholesterol. So public awareness of these issues is very important. So everybody, the African Americans, the Hispanics, and all people need to have frequent checks with their primary care physician in order to diagnose these diseases early and prevent development of worsening problems such as peripheral artery disease and heart disease. Of course, the cost of the issue of in healthcare is very important, but patients need to mention these symptoms to their primary care physician and go for routine checking. And the routine checking, could be rather of low cost, or it should be of low cost, in order for every patient to be educated and be given the appropriate instructions how to change their lifestyle and prevent the development of diabetes, treat their hypertension, prevent the development of high cholesterol. And by treating these diseases is the best way to prevent the worsening problems such as peripheral artery disease and heart disease.
So I want to make this clear to our viewers. Listen, folks, if you've got pain in your leg, going down the side of your leg like I did, and you haven't gone to the doctor, please go to your family physician. Get a checkup, because if you don't, you could lose more than what you expect. I can't imagine having to go through an amputation all because of ignorance, not knowing that this is something that could have been prevented had we just simply realized we got pain, there's something wrong, because we got to listen to our bodies. Something's wrong, and I need to get a checkup. Now I want to ask another question, Dr. Leon. Is this something that medical insurance should normally cover for anyone that needs to get an exam?
That is correct. All insurances cover for the very simple test that I mentioned earlier, the ankle brachial index, and then an arterial ultrasound to check the blood flow to the legs in the patient who has significant risk factors to develop PAD or any symptoms to suggest that may be a possibility of PAD. And these are non-invasive tests, which are rather inexpensive. In our office, and I'm an independent physician, we offer special low rates for patients who are paying out of pocket for this test, because we believe that everybody should have access to the basic health care for prevention and treatment of heart and vascular disease. So my goal as an independent physician is to be able to diagnose this problem and with as low cost as possible for patients who are paying out of pocket for their testing.
So it can be done directly in your office, this procedure to test for the PAD.
That is correct, and it's a very simple test we can offer with a very low cost in order to start the process of diagnosis of P.A.D., which can lead to a very serious complication in the future.
Now, when you go to treat it, it can be treated in your office?
That is correct. The treatment of P.A.D. starts with medical therapy.
Yeah.
Medical therapy consists of medications to decrease the symptoms, and then medications to thin the blood, such as aspirin or Plavix, and then treatment of the risk factors that cause the P.A.D., such as hypertension, diabetes, hyperlipidemia. After appropriate time with medical therapy, if the patient's symptoms continue, then we can do a procedure in our office to improve the blood flow in the arteries and the legs of the patients with peripheral arterial disease.
You know, this is just a blessing to be able to share with our viewers, because most people do not understand the fact that according to medical documentation, cardiovascular disease is the #1 killer of Americans today. And it kills more people than the flu, or than heart attacks, or, well, not heart attack, cancer, or some other disease. And so it's important for us to take care of ourselves, become aware of our lifestyles and how our lifestyles are impacting our health.
Yep. I've been to Dr. Leon's office and had the testing done because my legs were hurting at night and, you know, hurting during the day. And so it is very easy to get it done and not painful. That's the good news. That's the good news.
And he says that most insurances will cover the cost of a non-invasive procedure to just examine to see if you have peripheral arterial disease. I said it worked.
Yes.
And, so listen, folks, please, ma'am, sir, whoever, take care of yourself. Will you do that? Because your health is more important than anything else. You're watching Real Talk with the Jenkins. We want to thank you for tuning in. We want to thank all of our sponsors. And we pray that you take good care of yourself, okay? So, till next time, I'm Dr. G.
I'm Lady MJ. And we are the Jenkins.
Streaming worldwide, this is the Gospel America Television Network.